Hey, my name is Dr. Ricky Patel. I'm one of the OBGYNs here in Anniston, Alabama. I practice at RMC. I have a background in obstetrics, which is delivering babies, prenatal care, robotics, and also minimally invasive GYN surgery. But today we're going to talk about C-sections in this video. People are asking some questions that I'm more than happy to answer. Can you explain what a C-section is and why it might be necessary in some cases? So a C-section or a cesarean delivery is a surgical approach or operative, delivery if for whatever reason a vaginal delivery could not be accomplished. Typically that involves a fan and steel skin incision, which is kind of like a horizontal incision below the bikini line, probably about 10 centimeters or so, and we go through all the different layers of the abdomen, get to the uterus, and we typically make a horizontal cut on the uterus and we deliver the baby. Once we deliver the baby, we deliver the placenta and make sure bleeding and everything is under control, and we start closing up the patient in all the different layers. It is considered a major surgery, and it is one of the most commonly performed surgeries in this country as well as probably the world. And why it might be necessary in some cases. So, typically, as I mentioned, C-sections are performed when a vaginal delivery cannot be attained for whatever reason, and that's essentially, in a nutshell, to save the life of the mother and the baby. Of course, it's not always as dramatic as that always sounds, but, if you think back hundreds of years ago when, we didn't have modern medicine the way we do, there were, unfortunately, a lot of moms and babies that passed away during childbirth. And because of these modern, medical advancements, we have now, prevented quite a bit of that. How does a lower C-section rate affect recovery times and overall postpartum health for mothers, as well as improved outcomes for both mom and baby? So, as I mentioned before, the baby aspect is, we have to have a different approach for delivery because a vaginal delivery was not successful. But in terms of lowering the C-section rate, which means lowering the number of C-sections we perform, hence having more vaginal deliveries, the patient has a much better postpartum recovery. Imagine recovering from a big surgery versus, not having to be cut on at all. Most women with vaginal births, as long as it was relatively uncomplicated, their usage of pain medications, opiates, are extremely low. Recovery back on your feet, able to walk around, do daily activities, taking care of the baby, all that is much more comfortable. Also the healing process, you have a decreased risk of wound infections, decrease in bleeding as well, because typically when you're doing a surgery, you have a little bit more bleeding than if you weren't doing a surgical procedure to deliver the baby. And, I think overall postpartum health, quality of life, returning back to work, all of those things kind of go hand in hand in lowering the C-section rate. Also, complications in future pregnancies is huge, because if you do have a C-section, you are at a high risk of something called a uterine rupture and, hemorrhaging and those kind of certain events. Also, higher rate of scar tissue for future surgeries, things like small bowel obstruction further down the road. Those are all possibilities of having more surgery. What factors contribute to lower C-section rates? The overall culture of, where you're delivering, the OBGYNs that practice there, the nursing, how experienced and qualified the unit is in delivering, such as RMC, we do about roughly, 2,000 deliveries per year. I think, we have a pretty strong department. That alongside with keeping up to date with, evidence-based medicine, in terms of meeting certain guidelines for example, a failed induction, or what defines you not progressing in labor and arresting, or any of those things. What defines baby not looking too good on the monitor, right? The heart rate decelerations you may have heard about. There's definitions to all those things that we kind of use as the guidelines are set up to help us decide what's the safest route. Are there specific practices or approaches our hospital uses to maintain a low C-section rate? So I think, we can take a step back and, look at how do we define a C-section rate. So what we use to kind of score ourselves, and I think what most insurance companies and hospitals use as a grading measure is called the NTSV rate. That stands for the nulliparous term singleton vertex. So nulliparous means you never had a baby before, so this is your first baby. Term is, your full term, so after 37 weeks generally, which means that you're at a lower risk. If you had to be delivered prematurely for whatever reason, you're at a higher risk of a C-section or other outcomes. Singleton means one baby, not twins or triplets, because as we all may know, twins and triplets greatly increase your chance of having a C-section. So we score only the ones that have one baby inside. And vertex means the head is down, because typically when the feet are coming down first, we normally would elect to do a C-section at that point, because the risk of the head being entrapped inside after the feet have delivered, which can be very dangerous. So that's why we use the NTSV rate to determine how well we are performing and how well we're taking care of our patients. So knowing that that's kind of the definition that we use. Our hospital, I think a great asset that we have is we all collaborate together. All of the OBGYNs that we have in town, we all, about a year ago, we started to see our C-section rates climb a little bit, and we all kind of came together and said, hey, we have to kind of come collectively and see what we can do to bring this down. We all, reviewed all the recent literature, the recent articles, and in fact, I think we have one of the lowest C-section rates in our whole area. The last 4 quarters, it was about 23%, which you can Google other hospitals, including the ones in nearby cities such as Birmingham, other, maternity departments. I believe we have the lowest C-section rate. And, we also have blue distinction by Blue Cross Blue Shield, because if you're above a certain percentage, you will not be recognized by these insurance companies. What role does patient choice play in the decision to have a C-section or a vaginal delivery? And I think that's a great question. I think my colleagues like myself have a doctor-patient conversation, shared decision-making. It's my job to kind of tell you as a patient, hey, these are the risks and benefits of doing this versus that. And, as a patient, it's always your choice. It's your body to, have a say in the outcomes that you want. But I think both the patient and the doctor, we share a mutual goal in having the best outcome of a healthy mother and a healthy child. So, that communication, I think, is vital in this whole process. And there are other instances where a C-section may be necessary per the mother's wishes based on certain medical conditions that are specific to that one person, and those are exceptions as well. And again, that all starts with having that initial conversation with the doctor and the patient.